Hello everyone, this is Suzanne. I'm recovering from my total knee replacement. It's been quite a journey so far. When I arrived at the hospital, they were really quick about getting me back, getting my IV in, and they also they didn't do a whole spinal block, but they did do like from my thigh down, and they gave me a little bit of medicine to make me not aware of it. And then they told me I'd be in a lot of pain when I woke up. They took me back to the operating room, got me all set, and knocked me out. And after it was all said and done, the doctor said there was a tremendous amount of arthritis in my knee. So it was probably a good thing I got in there to get it done. From what I now understand, the longer you wait, the worse it can be. Because then that bone starts fraying and all kind of nasties can happen. And sure enough, when I woke up, it was painful. They came about a little over an hour out of surgery and got me up. I had a pain pump in for 3 days, which was nice. Wasn't too bad getting up at the hospital. I was surprised. I was at a surgical facility. They got me up and it was like, oh wow, it's not as horrible as I thought it was going to be. I didn't really feel much pain at all. Made sure I could go up and down stairs. Gave me all my instructions for going home. So my daughter brought me back home. Got in the house without any problem. And that first day, second day was like, yeah, this isn't too bad. And my physical therapy, she's coming out Monday through Friday for 10 days. And then we'll reevaluate. And she said, after the second day, she said, no, your third and fourth, maybe your fifth day are going to be some of your roughest, especially that third day. And it was. Oh my goodness. And they start bending your knee right away because they don't want that to get stiffened up on you, because then you'd never be able to walk again. So the physical therapist, of course, is adding more items to the list each time she comes. She comes around 1 o'clock every day, and she puts me through my paces. I have to get up every hour, walk a little bit, try to do a little bit further every day. I have to ice it every 30 minutes. And then I have pain pills that I can take every 4 to 6 hours as needed. And I didn't sleep good the first night. I was up going to the bathroom a lot, and they said that's because all the fluids were coming off that they pumped in there during my surgery. And my daughter kept saying, I just sat you down. You got to go again? And I said, yeah, I do. So, good thing I made food ahead. Got a few meals prepared ahead, so that took off a lot of the stress. And then today's day 5. She's coming out today. Like I said, my daughter had a doctor's appointment today, and it was an important one she couldn't miss. So my wonderful husband has been taking care of me this morning. Of course, I feel bad for him because his back is really hurting, and I have to do the physical therapy twice a day, and my daughter has to be here for the second set because my husband's not able to lift my leg and do all that bending with his back. So I'm getting real good care. I am feeling a little better every day. The pain is starting to change a little bit every day. The physical therapist just says, hang in there. She said day 7 is going to make a huge difference, and by the end of the sessions next week, like a week from Friday, I should be doing really well, because my concern was, how am I going to get up these stairs, as painful as this is, and get out my car and go to regular physical therapy? But she said, no, we won't. We'll reassess you and make sure that you can tolerate that, and before we just cut you loose. She's really good. She calms all my fears. I was really fearful getting up, and I tried to remember the scripture, fear not. Sometimes it worked, but it's true. If I relax and I release the anxiety that I have about it, it does go better. And I have to remember to breathe and stand up straight when I walk. And today's, I will admit, today's more tolerable than what it's been. It has its moments where it spikes off and on. I'll be glad when I'll be, it's probably going to be a good 2 solid weeks, maybe 3, before I get back on here and we get back into our Revelation study. I'm just playing it one day at a time. By the time I get physical therapy done and I get that ice back on, I'm done for a while. Like, I'm done, okay, I'm done. But my daughter's a great taskmaster. My husband is too. They're not letting me get away with anything. And that's good, though. That's what you need, is somebody to advocate for you. That when you don't feel like doing something and you're in so much pain, let them do their job. Because they're only looking out for your good, and that even though it don't feel like it, I mean, I would rather have a baby than go through this pain. I mean, at least I had my babies 24 hours it was done, which is really cool. My son, it was like 6-7 hours. Then I had the baby. There's no baby with this. So, yeah, it's I can't say it's what I thought it would be, because I didn't know what it was going to be. And I watched all the YouTube videos and the surgery and, all the different people that had it done and this and that. They say that it's really going to hurt. That first week is going to be, not so pleasant, but then it gets better and better. And then once it's all better, a lot of people say, I don't know why I didn't have this done earlier. I'm going, I do. I know why. It hurts. My right knee is not bone on bone, but there is arthritis in that knee too. But it's going to be a long time before they take me back into surgery for that one. I'm going to have to be really bone on bone. Because, wow. You really can't describe it to somebody until they go through it. They kept telling me, oh, everybody's different. And on these YouTube videos, these people would get up and, yeah, day 3, I'm doing really good. And I'm going, no, what? No way. I mean, must have caught them on their pain pills or something, because everybody I've talked to that had this say, yeah, that's a toughie. I think this one is worse than hip replacement. Hip replacement is a close second. My physical therapist said that total shoulder replacement is a tough one too. Anytime they have to go in and replace a whole joint, it's not good. And especially the knee, they had they take your bad knee completely out and they cut a lot of bone away, and they put in that knee place, that false knee. All right, everyone, I'm going to have to go. I got to get ice. My pain levels are starting to rise up. I wanted to try to get on here and get this done. So in a few days, I will give you another update. Bye for now.